Hey, hi, I'm Dr. John Minichetti. I am one of the co-chairs of the American Academy of Implant Dentistry's 2025 meeting. It's going to be in Phoenix, Arizona, November 12th through November 15th. What a great location, and what a great bunch of speakers and lecturers we have this year. And I'm happy to be with one of our speakers who's going to be speaking on Saturday morning. Towards the end, that's when we get into the complication stuff. This is Dr. Purnima Kumar. She happens to be chair of the University of Michigan's Department of Perio. She's got her PhD in perio and biology, and she is an expert in treating periimplantitis. So tell us about your topic, Dr. Kumar. Thank you for coming on, first of all.
Thank you. Thanks for the invitation. I owe it to my friend Suhail Boutros. Go Blue. Ha.
Oh,
So,
Sue, sucked you in. I love it.
yes, yes.
Well,
So,
thank him
so
and thank
it's
you.
it's going to be a great meeting. I look forward to sharing the podium with at least on different days with my classmate from dental school, Dr. Shankar Iyer as well. So,
Yeah.
it's going to be homecoming of sorts. Dr. Boutros from the University of Michigan, Dr. Iyer from Annamalai University.
One
It's
big
definitely
happy family of
going to be a
implantologists. There you
big reunion. So let me tell you a little bit about what I'm going to be talking about. So, in my practice, unfortunately, I treat more periimplantitis than I treat periodontitis. People think that every tooth that has the smallest lesion of any sort, either periodontal or caries related, is doomed. Has a poor prognosis. Well, it'll fail in 5 years. It'll fail in 10 years. Let's take it out today. And so an implant goes in, but then the lifetime of the implant, the lifespan of the implant is just as limited. And we are learning now very quickly that the implants might not get disease. Of course, they are disease free, but the tissues around implants get morbid disease, and when implants go south, they go south very horribly, and we are left with this giant man-made defect that now is very hard to reconstruct, to regenerate, and then to restore with a new implant. And the question is, how are you going to give your patient a second implant when you don't know why it failed in the first place? And so, I ask myself that question every single time I have a patient who says, I need a new implant because this one's failing. And so then I take off my clinical hat, my DDS hat, and then I put on my PhD hat and I say, let's find out why this went south. And we're learning a lot. So my other hat is I'm a microbial ecologist. I study how microbiomes keep us healthy and what happens when they go south. Why do they get what is called dysbiotic, and what happens when they get dysbiotic? How do they disrupt these systems? So I used a very systems biology approach, and we're learning some very important things, that bacteria and fungi actually participate in keeping your implant healthy, and that when those communities are disrupted, broken down, we're going to talk about the different things that we do intentionally and sometimes the unintended consequences of things we do that lead to this phenomenon called dysbiosis, and how that leads eventually to disease. So I've given this talk on many different other platforms, on different forum, different things, and it's always generated a lot of conversation. It's not a traditional way of looking at implant disease, so I'm not going to do a show and tell.
Mhm.
Here's what I can do. That's not this talk. This talk is really, let's understand what it is that we're treating. Know thy enemy is
Right.
is really the basis of this. And so I'm going to use science to combat my lack of clinical ability to predictably treat this disease.
These are really good points, because this is something that's been a dilemma now with the profession for many years. We run into these patients with periimplantitis, inflammation, etc., in different degrees. Sometimes it just stops at one point. Sometimes it continues to the end of the implant. And the theory is we're really just not sure of what actually can cause bone loss around implants. It's certainly this microfloral that you're talking about. But there's other theories, overload, right? Autoimmune, right? Patients may have a reaction to titanium. So there's a plethora of possibilities of disease causing problems with implants, but you're going to focus on the bacterial aspect. Am I correct?
Well, that's one of the aspects I'll be
Yes.
talking about.
Right.
So we will set the stage, and just to give you all a sneak peek in what's coming. In May 2026, the American Academy of Periodontology will be doing a best evidence consensus on understanding the risk for peri-implant diseases, and we're
Right.
going to be discussing methods of prevention, and we're going to start with primordial prevention. And I'll be talking a little bit about that at this
Wonderful.
lecture as well. What is primordial prevention? That prevention of peri-implant diseases begins before you place the implant,
Okay. Absolutely.
right?
Yeah,
Right.
absolutely.
So
You'll have to let
so
us in on this.
it's great. So I'm sharing that BEC and the best evidence consensus, and I'm super excited for it. We're writing the review articles now. We
Beautiful.
have 65 participants coming from all over the world.
Mm.
And we have everyone from periodontists, prosthodontists, oral surgeons, hygienists on the
Wow.
panel.
Wow.
Everyone. So that is going to be an incredible fact-finding mission, so to speak. And I'm super excited for
Great.
it. But I'll be sharing some of that, what led to me even proposing such a thing to the AAP and why we're doing this there. Yeah.
We appreciate that. We appreciate you bringing us information from the experts in perio to our Academy of Implant Dentistry. Very much appreciated. Thank you so much for that. So yeah, let's talk about because this is something that fascinates me because I'll tell myself personally, I'm a general dentist, 40 years. I've always incorporated implants. I was introduced many, many years ago. But I'm of the opinion that people are not saving teeth. You mentioned it earlier. What is going on with the world of dentistry? I mean, people just are not saving teeth. And it's almost like when I started doing implants, I had to talk patients into getting an implant because that tooth was totally hopeless. Now I'm almost talking patients to save their teeth. What is going on?
Exactly. I mean, I see patients on Wednesdays, and I had this 25-year-old graduate student in my chair who was convinced that number 30 had to be extracted and replaced with an implant. And there was a carious lesion extending to the periapical regions, and I was like, yes, there's a PARL, yes, but there's sufficient crown structure for us to be able to do a good root canal, crown lengthening, and a crown. And let me buy you time with this tooth. And it took me almost 30 minutes of explaining to her, here's the reason why we should do this and you should. Whole thing was, why am I going to invest twice on the same tooth? And the answer was, you're going to invest twice on the same tooth anyway. Either you invest in a root canal and a crown now and an implant later, or you invest in an implant now and an implant later,
Correct.
right?
And
So
the, and the dilemma becomes if that implant fails, it's a big failure. It's a
exactly.
big amount of bone loss.
Exactly. When an
Right.
implant goes, it takes a lot of bone with it and
Correct.
soft tissue with it. So reconstructing all of that. And so I always tell my patients, I'm not going to guarantee that you're going to, if I work in your mouth, doesn't mean that you're going to take these teeth to the grave with you. What I'm going to be doing is buying you time with these teeth. And
Right.
what happens, three very important things happen. The first thing is you learn to manage expectations. When you get a knee implant, you're not going to run the Boston Marathon anymore.
That's right. That's
Two,
right.
the implant has to live a few less years in your mouth. I mean, if I do an implant when you're 40 versus when you're 60, that's 20 years less of implant that has to live in your mouth. And therefore, the success rate is much higher. And the third most important thing is technology improves. The
Right.
version of implant that you're going to get today, the 2025 model of the implant, is definitely far less inferior than the 2045 model of the same implant. Why would you not buy the latest version of it?
I agree. Who knows?
Right?
Who knows? 10, 20 years we may be implanting cells that will grow teeth. Who knows?
Oh, that. Or we
Right?
may be doing drill-free implants. There's already a lot. A colleague of mine is piloting something like that in Brazil. And so we're advancing faster than we have ever done in the past years, right? The advances that we've made in the last 10 years, we didn't make in the 100 years before then. So we're really advancing at an exponential rate. So these are things that we have to consider. And I always tell my students, You're a dentist. If you take out the dent, what kind of an ist are you? Extraction is terminal treatment. Terminal treatment. Once the tooth comes out, what do you have left?
You're right. You're right. You're absolutely right.
Right?
Absolutely right. This is a field in implant dentistry that really needs to be developed and grown and a lot of attention because you're right. Everybody's been focusing on placement, 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 reconstruction, pulling all teeth, and no one's focusing on what are the consequences and if we have problems, how to deal with it. It's a dilemma.
It is. It is. And I feel like the pendulum is swinging back now. People are really going back to the basic reasons of why we are dentists
Yes.
and why, we save teeth,
Yes. Yep.
right?
And hopefully there'll be some more studies going out there that show the longevity of teeth are just as good as the longevity of implants.
There are plenty of studies. We just have had,
No
because
one's
they didn't
everybody's
suit
ignoring
our, exactly, because they didn't suit our purposes, we've put them aside. But back in the day when saving teeth was all we could do, we had a lot of studies that glorified saving teeth.
Absolutely. I agree. I agree.
Right? I mean, if you look at the Carnival studies, furcation involved teeth, 22 years with class 3 furcations. Man, so, so
Incredible.
tell me a furcation involved tooth cannot live stably
Correct.
in someone's mouth. There's
Absolutely.
studies that are show you otherwise. So
What happened to those root amputation procedures you guys used to do?
we still do. I do a
Look,
lot of
I mean, I could still do it because I was taught in school, but people now just pull it, right?
no, no, no. I do a ton of root amps. My residents do a ton of root amps.
Beautiful.
Great way of holding on to an otherwise,
Yep. I
questionable.
tell the story of my aunt who came to me when I was just started practicing. So they're always leery. I just got out of my residency and I learned. And so I did, somebody told me how to pull it tooth. I go, try this root amp. That root amp lasted for the rest of her life. She was
There you go.
probably 40 something when she came to see me. She died at 92.
There you go. What a success story that is, right?
Same tooth. Same
Yeah,
tooth. And
same
she
shit.
came in for her cleanings all the time. Maintenance, maintenance, maintenance. That's what it's about, right?
Yep,
Absolutely.
absolutely. My friend Paul Rosen, he has a quote, and I'm going to freely borrow it from him. He says, "Teeth never get peri-implantitis, so save more teeth."
There you go. That's right. It's a good one. So, are you excited about coming to Phoenix to our AAID
I
meeting?
am. I really, really am. I'm actually going to be flying in from, I'm going to say Madrid. I have a
Oh,
meeting.
wow.
So, yes, 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 yes. We're
Well,
doing
thank
a
you.
treatment guideline with the European Federation of Periodontology, and I'm going to be flying in from there. But and
Beautiful.
it was very tight. But I said, I am not going to miss this for the world. I am not going to miss this for the world. So
It's been an outstanding
really,
meeting. Dr.
it's
Jackson, my co-coordinator, has done a great job. Dr. Iyer's been on our committee also helping us select. Not only do we have great main podium speakers such as yourself, many of our lecturers are also giving hands-on workshop. We have a lot of opportunities for hands-on workshops. We have poster clinics. We're going to have table clinics there. We have a corporate forum this year. The exhibit hall is going to be packed because we have a big space. This is our first meeting at a conference center
oh,
in Phoenix. So we've grown, which is wonderful. We have plenty of room for a lot more activity. We're gonna have
congratulations.
yeah, it's wonderful.
The beautiful conference center. We held the Perio meeting there a
Oh,
couple
did
few years
you?
ago. It's
Oh,
absolutely spectacular.
I went to visit it last summer. It was totally hot, like 116 degrees. But in November, it'll be perfect.
It will
So
be.
that'll be one good thing. And we're having an outdoor fair as one of our socials, a couple other socials. We're presenting about 200 certificates for the Associate Fellow to our credentialed members who have achieved the first level of credentialing in implantology. And also, we're be awarding diplomat status to many of our Academy members.
Oh,
So
wonderful.
we
What
are
an
having
exciting
a
meeting. What an
full, full.
absolutely so much happening.
Hope you could spend a day or two after your meeting or lecture. Of certainly, you're invited to our socials, and we'd love to have you. We thank you so much, Dr.
Thank
Kumar, for making
you.
your
Thank you.
busy schedule to come. And I'm sure Dr. Boutros did a great job in getting your butt out to Phoenix, and Dr. Shankar probably had something to do with it too. So thanks again.
I'm sure. I am sure. It's good to always reconnect with old friends and to make new ones. And I look forward to this. I mean, it sounds like a great meeting. Super excited to be there. And Phoenix is lovely, and the convention center is even more beautiful. So,
Super.
yeah, yeah.
Thank you so much. Thank you so much. I wish you a great summer. And thank you again. Keep up the good work and keep up the research. Well needed.
We all need to hold up those walls. So, thank you.
Absolutely. Check it out. AID meeting, November 12th through 15th, Phoenix, Arizona. We will see you there. Bye.
You there?